Good afternoon. I'm James Mallory. I'm the chairman of the Iredell County Board of Commissioners. And on behalf of the entire Board of Commissioners, I'd like to give you a COVID update on December 18th, 2020. Currently, we have 7,773 positive cases that have been identified through the system. That doesn't cover cases that we are not aware of, or people who have been asymptomatic and not been tested, or who have been symptomatic and not been tested. The numbers over the last several weeks, since Halloween, have been going up precipitously. We've had 2 holiday events at the end of the month, Halloween, followed by Thanksgiving, and we're preparing to, of course, go into the Christmas season, New Year's celebrations that traditionally have been driven by large gatherings, and at that point we anticipate another round of increases. The increases that you've seen in the last several weeks track about 3 weeks or so behind the events, and we have a lot of super spreader events of gatherings that have occurred. And we've gone from roughly 50 cases a day to almost 180 cases per day. And so this exponential growth is setting a floor that after Christmas, we're very concerned that we're going to see just explosive growth. So, any strategy to deal with this pandemic at the highest levels, at the federal level, at the state level, starts off with a campaign, if you will. And that really occurred back in the spring and summer about setting what the response was going to be at the federal government and the state government levels. Included in that is obviously Operation Warp Speed to fast track and accelerate the development of vaccines through the funding of that R&D effort, which is normally lacking, and which is why normal vaccine development takes a long time. Well, with some money in the pipeline, that has juiced the whole process, and we've been able to get a vaccine, 2 of them, Pfizer and Moderna, that are going to be available during the month of December, starting with healthcare workers and then first responders, as well as then focusing on our vulnerable populations in congregate care homes, nursing homes, rehab facilities, and such. The general public won't really have availability of a vaccine till late winter, early spring, March, April timeframe. By then, we anticipate that there'll be several different vaccines that are available, including one from Johnson & Johnson, many of which may not involve having 2 injections, but just 1. So stay tuned because that vaccination program, which is been in large measure inspired and funded by Congress and President Trump, will be coming to fruition. And people will have an opportunity to have seen leaders in their healthcare community and those others who have taken those vaccines early and be able to see, that there is very little to be concerned about in terms of reactions from a vaccine. And so just stay tuned to those developments. Right now, our concern is over our hospitalization rates. The numbers in the hospital today were as high as 63. That's about double the rate of hospitalizations that we have experienced at the highest point of this pandemic back in July. That is very close to full capacity as far as our ICU capacity. Iredell Memorial Hospital, for instance, last week was around 88% of their ICU capacity. And that's where we have the ability to treat those that are having the most severe symptoms, and ventilators and the trained staff to be able to monitor and minister to them. If we're that close right now, we're very concerned about if our current hospitalization rate increases because of Christmas gatherings, that we will exceed that capacity. And while you may have bed space generically available in a hospital, what you don't have is the trained ICU staff to be able to service those, or the ones that you do have are then overtaxed and overstretched in terms of their abilities to give the level of service that they are accustomed to providing. So Iredell County right now is not in a good position relative to other counties in the state. The positivity rate of infection is at 16.2%. There are only 5 counties in the state that have a higher positivity rate. The positivity rate average in the state is between 11 and 12%. That 16.2 puts us at the top of highly infectious, community spread, critical situation. So how do we get that down? Well, the overall campaign strategy that's been developed at the federal and the state level is that's already been executed. The implementation of that strategy at the state and local level has likewise been implemented. At this point, there's not much more that the feds or the state or local government can do than what we're doing already. At this point, the onus is on individuals. It's about what you do individually to take care of yourself, your family, and your community. And how do you do that? Well, we've talked incessantly, consistently about the 3 W's: wearing a mask, waiting 6 feet apart, social distancing, as well as washing your hands. Everybody's heard that. But whether you implement that is up to you. We're really concerned about gatherings over Christmas. If you're having a Christmas gathering, it really shouldn't involve more than, your household. If there's members from another household in the home with you, you need to look at making sure you've got good ventilation, and that you do continue to maintain that social distancing, even though you're dealing with family members, because those family members have been in contact with people outside the household, and you don't know who that might be. There have been a number of different super spreader events, mostly driven by folks that ought to know better. You know, when you have a birthday party for a teenager out on the lake in an Airbnb and you invite 90 people, the result is going to be a foregone conclusion. And the consequences are far and wide. If you are going to church like many of us do, there's a safe way to do that. There's a safe way to worship. There's a safe way to celebrate Christmas. And that's observing those same proprieties and then limiting your contact with other folks. So I strongly urge everyone to step up and take responsibility for their own actions, because it's going to require everyone individually. We can't do it as a government. We can't do it as businesses alone or as churches alone. It's going to require individual responsibility and common sense and goodwill to our neighbors. So I thank you for tuning in and getting this update. I will tell you that there are going to be some changes in the format in which we report data. Heretofore, we've been able to collect that data directly based on testing that we did through a contractor. Now all of that contact tracing and the test results will be funneled to us from the state. Now there's a little bit of disconnect between state numbers and our numbers because we started tracking cases based on antigens before the state did. So that right there is about a 500 count difference. But we will be able to get on a routine basis the daily case count increase. We'll be able to get our hospitalizations, and obviously we'll also know those who have passed. And at this point, we've had 89 Iredell County residents who have died as a result of this virus. So that number is climbing inexorably. In the month of December so far, just in 2.5 weeks, we've had 26 folks pass. That's friends, that's neighbors, it's family members, and we grieve for them. Don't let that be part of your post-Christmas recovery. Hopefully we're all recovering from just overeating. So I ask you to double down. The vaccines will be available in 3 months. It's darkest before dawn, but dawn is coming. Thank you, good luck, and God bless.